primary thing that every patient who walks into our office gets is a chiropractic adjustment. Everybody's heard of that, everybody's had their own different opinions on it and think about different things. Funny thing about people with chiropractic opinions on chiropractic is most of those people who have opinions have never been to the chiropractor. But chiropractic is a very simple procedure. It's a very simple, it's an art actually. The art of the adjustment is something that is very important, and each chiropractor is a little bit different. Each chiropractor does their technique is a little bit different, but the number one thing about chiropractic adjustments is they should never hurt. It should never hurt, and it doesn't hurt. Now, if you walk into the office and you're in a lot of pain, if it hurts just to walk, it's going to hurt, of course, to get adjusted, because adjustments are just nothing more than moving bones. Now, we have 24 bones in our spine, and these bones are movable, and they move on each other, which allow us a tremendous amount of range of motion. Now, oftentimes, due to something like a bad fall or playing sports or any one of 1,000 things, these bones get misaligned. What chiropractors do is they find these misalignments, gently manipulate or adjust these bones, putting them back into their normal position. Now, many people have played sports and they've twisted their ankle. And when you twist your ankle, it's essentially the same thing as most of the injuries that happen that chiropractors treat. Most of the things that we treat are called facet syndromes. And a facet syndrome is just kind of another fancy way of saying joint sprain. So you have this bone that has been moved out of its normal position, and those of us who've sprained ankles know that the first thing that happens with an ankle sprain is it swells. The swelling is the body's natural reaction to this injury to limit the range of motion so that it A, doesn't get worse, and B, gets better quicker, which was a very good thing. But now our technology has improved, and the best thing we can do is remove the inflammation and restore the normal joint function by giving it an adjustment. So the chiropractor comes in, finds the bone that has moved out of position, adjusts it. We, in our office, we do a great deal of physiotherapy on these things as well. So we'll use different types of physiotherapeutic machines and ice, and all the things we're trying to do is reduce the inflammation so that we can restore natural function. When you have these bones out of place, not only is it painful, but the joint also becomes weak. And if you allow that to stay there for a long, long time, that weakness becomes normal to you. And you've lost that percentage of strength just because the joint is now what chiropractors call subluxated. So what chiropractors do is we look for these subluxations, adjust the bones, move them back to their normal alignment, normal position, reduce the swelling, and come back to normal function. Normalization of function, essentially, is what a chiropractor does. It's like when your front end of your car goes out of alignment, you go to Midas, they fix your front end of your car, and all of a sudden the car that was bouncing all over the road is now driving down the road the same as it was. It's back to normal, and it doesn't have the same bounce to it. And essentially that's what chiropractors do. We find bones that have moved out of alignment, put them back to normal so your front end is working correctly and you're able to drive down the road without pain.